Welcome back, Careblazer, to the place where we talk about everything dementia. Dr. Natalie here, and if you have been following us for a while, then I'm sure you can tell today's video is a little bit different. We have something super exciting for you that we've never really done before, and one of the ways our team came up with this idea is that I've been traveling a lot recently. I've done some amazing keynote presentations in different states. I've been connecting with so many of you Careblazers in real life, and that has been such a treat. I even had the amazing opportunity to go visit a respite program down in Alabama. And as I was thinking about, what video should we post on this Sunday, we have been posting a new training video every single Sunday for years. And I realized that some of you maybe have only been catching some of our more recent videos. So what my team has done is they looked up the 3 most popular videos of all time on our YouTube channel that we have put out. And these videos have received millions and millions of views, hundreds and hundreds of comments. And we want to make sure that if you are newer to us, or even if you've been following us for a while, this could be a great refresher. We are going to share some key takeaways from our top 3 videos of all time. I hope you enjoy. Before I get into the top 3 reasons why you may need to consider nursing home care for your loved one, I first want to say that not everybody with dementia needs to live in a nursing home. There are people with dementia who are able to live in the comfort of their own home by accepting help from family, friends, neighbors, and community agencies. Some people with dementia are able to live in the comfort of a family member's home, such as a child or grandchild. Other people with dementia may require a step down from nursing home care and live in a place such as an assisted living facility, a personal care home, or even a group home setting. The best place for your loved one with dementia to live and grow old depends on several different things, including what help they receive, their willingness to receive help, their physical abilities, and the specific dementia symptoms they have. So not everybody with dementia requires the same level of care. For instance, somebody with mild Alzheimer's disease can require a totally different level of care than another person with mild Alzheimer's disease. So even people with the same exact disease and the same stage of disease can require different types of care. Reason number 1 has to do with safety. If your loved one is no longer safe to be living at home, then they may need nursing home care. Now, the second reason that your loved one may need nursing home care comes straight from the research. There's been plenty of studies on this, and in fact, it tends to be a common one among the caregivers that I work with, and that is when your loved one with dementia starts to lose control over their bowels. This gets to be a really difficult time in every caregiver's life because their loved ones are having lots of accidents that require a lot of help and time cleaning up. And unfortunately, with dementia, many of the people who have the disease don't like to stay clean or may not want to change their undergarments or clothes and may be hesitant or scared of the bath and shower. So that just raises the risk of infection and other health problems. Reason number 3 why your loved one may need nursing home care is perhaps the hardest one for caregivers to hear, and that is caregiver stress. Now, I am not talking about the normal level of caregiver stress that comes along to everybody caring for a loved one with dementia. I'm talking about the level of caregiver stress that makes it difficult for you to get yourself out of bed in the morning. The one that has you at risk for losing your job because you're constantly showing up late or missing work or leaving work early to take care of your loved one. The level of stress that has your important relationships hanging on by a thread because you're spending all your time and energy on your loved one with dementia that you have neglected your own kids, your own marriage, and your own friends. The kind of stress that has you feeling depressed, anxious, the kind of stress where your health is suffering because you have put yourself on the back burner and have placed your loved one as the #1 priority, letting yourself fall behind. There are different staging models for dementia. The two most popular are a 3-stage dementia model and a 7-stage dementia model. Now, before I get into the specifics of both of these stages, it's important for me to mention a couple of things. The first thing I want to encourage you to think of when we think about the stages is to think about dementia on a continuum, with no cognitive impairment on one end and very severe cognitive impairment on the other. Try to think of these stages as fluid, with the ability for some slight changes and variation, rather than true stages with a clear beginning and a clear ending. In many cases, it can seem like your loved one is stuck in between stages, and that's okay too. The second thing I want you to keep in mind is that there is no set time for how long somebody spends in each stage of dementia. The progression is different for everybody. There's a lot of different types of dementia, and there's a lot of different factors that go into the progression of dementia. So even people with the same exact type of dementia could progress at different rates. Also, the last thing I want you to keep in mind before I get into the specifics of the dementia stages is that there is not one symptom that will tell you exactly what stage your loved one with dementia is in. I want you to take a step back and look at the bigger picture. Look at their symptoms, but also look at their functioning, look at their environment. We have to take a bigger look at how your loved one is doing versus just what symptom they're showing. That's the reason that they're starting to have some difficulty. Sometimes it's easy for family members to just assume that the struggles they might be noticing are normal given their age. So some specific examples that someone might show in the mild stage include difficulty making a grocery list and then finding those items in a store. They might start to lose things more frequently, getting lost while driving. In some cases in this stage, it's very easy for people to cover up their problems, or for family members, especially spouses, to cover up these problems. In some cases, no one even realizes these problems are occurring until they start to advance to the moderate stage, or when a family member or friend who isn't around as much comes around for a visit and starts to notice the big changes. Sometimes when we're too close to something, it's easier for us to miss the change that's happening in front of us. The next stage is the moderate stage of dementia. In this stage, people start to have more memory loss, some confusion, and more personality changes that start to become more obvious to the people around them. So some of the things you might notice in this stage include changes in sleep. They might start wandering. They might start having difficulty with their hygiene. They might not be able to make it to the toilet on time anymore, or start to have some accidents, and possibly even some behaviors such as kicking, screaming, hitting, or accusing people of stealing or cheating. In the severe stage, this is probably the easiest stage for everybody to recognize. The person with dementia is essentially no longer able to do any of their daily tasks. In this stage, the person with dementia can't use toilet, they can't clean themselves or eat on their own. Oftentimes they can't walk, they're unable to talk, or maybe just mumble a couple of sounds or words. They may no longer even recognize their family members. Some may even stop eating and have difficulty swallowing. This is the last stage of dementia, and it eventually ends in death. So that's the simple 3-stage model of dementia. It's the model I prefer. It's the model that a lot of healthcare professionals tend to talk about when they're talking about dementia. Stage number 2 is very mild cognitive decline. So here we'll see normal memory loss associated with aging. Stage 3 is mild cognitive decline, where friends and family members may begin to notice that the person's having some thinking problems. In stage 4, there's moderate cognitive decline, typically where the disease gets diagnosed, there's poor short-term memory, the person's starting to forget personal details, and having difficulty with simple math. In stage 5, which is moderately severe cognitive decline, the person with dementia begins to need help with daily activities, they start to have significant confusion, they may be disoriented, and they may no longer be able to live alone. In severe cognitive decline, there's worsened memory loss, difficulty recognizing family members, and even some major personality changes. In stage 7, there's very severe cognitive decline. It's the final stage, communication is limited, the physical symptoms also start to decline. In today's video, I'm going to share with you the 3 things to never ever do with your loved one who has dementia. These 3 tips will not only help make your life a lot easier, it will lower the chances that your loved one is going to feel agitated and have a lot of behavioral outbursts during the day. Tip number 1 is do not argue with your loved one who has dementia. Just don't. Arguing with your loved one is going to make the situation worse, and it's also going to be more likely that your loved one's going to get agitated and start having some of those difficult behaviors that make your life so hard. So instead of arguing, instead you just want to acknowledge what they're saying, what they're going through, give a brief response, and then redirect whenever possible. Tip number 2, do not try to correct your loved one. Here's an example. Your father, who has vascular dementia, starts to talk about how he went to work yesterday and has to go back to work tomorrow, even though in reality he hasn't worked in 10 years. You don't want to say, "Dad, you don't work anymore, you're retired." Instead, you might want to try to use your active listening skills and nod, smile, say that's nice or okay, and then move on to something else. No need to correct him, let him talk, and your life will be much easier, and he will be content to go along talking and sharing what he believes to be true. Tip number 3, do not try to reason with your loved one. Trying to reason with your loved one is a losing battle because they no longer have the ability to reason, and you can't win, so to speak, with your loved one who doesn't have the ability to reason through what you're saying. Number 1, do not argue with your loved one. Number 2, do not correct your loved one. And number 3, do not try to reason with your loved one. If you can master and avoid doing these 3 things, your life as a dementia caregiver will be much easier and less frustrating, and it's going to make your loved one better because you're not challenging them in a way that they can't understand. So it's a win-win for both of you.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.